Have you noticed that someone you love has begun to show subtle but concerning changes over the past year? Many people believe that death in old age arrives suddenly, but the reality is that the body often sends quiet signals for months, or even a full year, before life reaches its final stage. The problem is that most people overlook these indicators because they seem minor at first. Only later, when looking back, do families realize that the clues were there all along. But by then, it is too late to prepare, too late to make those final memories truly meaningful. In this video, we're going to talk about 5 key signs that often appear 1 year before an older person passes away. Some may be things you've already noticed but dismissed as a normal part of aging. Others may seem insignificant changes that actually signal the body's gradual decline. Recognizing these signs early gives you the opportunity to provide better care, cherish meaningful moments, and, most importantly, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay until the end, because these 5 signs can help you prepare emotionally and practically for what lies ahead. When you understand what's happening, it won't catch you off guard. You'll be able to make the most of the time you have left with those you love. Now, let's begin. Number 1. Significant weight loss. One of the earliest and most revealing signs that someone may be entering their final year of life is unintentional weight loss. At first, it may seem subtle, a belt that suddenly needs tightening, clothes that fit more loosely, or an appetite that quietly fades. Many families brush this off as normal aging, but losing weight without trying is rarely a good sign. It often means the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and vital systems are slowing down. While aging does involve some natural muscle loss, when it happens too quickly, it points to deeper issues. The body may be struggling to digest food properly, or the person may no longer process protein effectively, leading to muscle wasting. This loss of strength doesn't just make movement harder. It increases the risk of falls, weakens the immune system, and leaves the person more vulnerable to infections. Another common cause of weight loss in the final year of life is changes in appetite. Many older adults simply don't feel hungry the way they used to. Their sense of taste dulls, food becomes less appealing, and they may skip meals or eat much smaller portions. This goes beyond preference. It's a physiological change. As the body senses that it is beginning to shut down, it signals the brain less often to seek food. The result is less energy, less strength, and a steady decline in overall health. Then there's the impact of underlying medical conditions. Weight loss often accompanies chronic illnesses such as cancer, heart failure, or kidney disease, conditions that can progress long before obvious symptoms appear. Even depression or cognitive issues can reduce food intake, creating a downward cycle where the body doesn't receive enough fuel to sustain itself. Some families try to fix this by encouraging more eating, offering favorite foods, or adding protein shakes. But if weight continues to drop despite these efforts, it's important to recognize that the issue isn't just diet. It's the body preparing for a profound transition. At this stage, forcing large meals may not help. Instead, prioritizing comfort, easy-to-eat options, and hydration often supports quality of life better. If an older loved one shows noticeable weight loss, especially alongside reduced appetite, increasing weakness, or difficulty staying active, it's time to pay attention. This isn't just about appearance. It's the body sending a message. Understanding that message today can help guide you forward with clarity, compassion, and the ability to make every remaining moment truly count. Number 2. Extreme fatigue and weakness. One of the most noticeable changes in the year before the end of life is deep, persistent fatigue that rest does not relieve. This goes far beyond feeling tired after a long day. It's a heavy exhaustion that makes even simple tasks feel overwhelming. Getting out of bed becomes a challenge. Crossing the room takes effort. Activities that were once routine, cooking, dressing, or even holding a conversation, begin to feel too draining. This isn't just aging. It's the body conserving the energy it has left as organs slow down, the heart pumps less efficiently, circulation weakens, and muscles receive less oxygen than before. That's why many older adults in their final months feel unsteady, weak, and unable to maintain their previous level of activity. Another key factor is a slowing metabolism. The body, designed to produce and use energy, begins to redirect it in its final phase. Instead of fueling movement, it focuses on preservation. As a result, someone in decline may sleep more, need long naps during the day, and struggle to stay awake for extended periods. Some experience sudden drops in energy, fine one moment, completely drained the next. Perhaps the most heartbreaking aspect is the emotional impact of this fatigue. Older adults who once took pride in their independence may feel frustrated or ashamed by what they can no longer do. They may withdraw from conversations, avoid social interactions, or give up hobbies, not because they've lost interest, but because they simply don't have the energy. This can create cycles of isolation that accelerate decline. For families, watching a once active loved one become exhausted and withdrawn is painful. It's tempting to think they're just being lazy or need encouragement, but pushing activity often doesn't help. What matters most is respecting their limits, allowing the rest they need, and making their remaining days as comfortable as possible. If you're still here and finding value in this, comment number 2 below so I know you're watching. And if you haven't subscribed yet, consider subscribing and turning on notifications so you don't miss future videos. Your support allows us to keep creating high-quality content to inform and inspire. Let's continue. Number 3. Increasing cognitive confusion or withdrawal. As someone approaches the final stage of life, noticeable changes often appear in thinking, communication, and interaction. You may notice that a person who was once sharp becomes more forgetful, struggles to follow conversations, or seems disoriented in familiar places. They may repeat stories, forget names, or lose track of time, even without previous memory issues. These gradual cognitive changes can emerge months or even a full year before death. This isn't just everyday forgetfulness. The brain requires a constant supply of oxygen and nutrients. When circulation weakens, cerebral blood flow drops, reducing brain function. The person may become easily confused, struggle with decision-making, or fail to recognize familiar faces and places. Some experience moments of clarity followed by sudden confusion, as if the mind is flickering on and off. Another common sign is emotional withdrawal. Those nearing the end often lose interest in social interaction. You may notice quieter speech, less engagement, or long periods of sitting in silence. This isn't a lack of love for family. The brain processes emotion and interaction differently now. Conversations become tiring, noisy environments overwhelming, and many retreat inward. Mood and behavior changes may also appear. Some become more irritable, anxious, or easily frustrated. Others grow unusually calm, distant, or indifferent to passions they once loved. This isn't simply a personality change, it's the brain adapting to physical decline. Slower cognition makes it harder to express emotions, altering reactions. For families, watching reality slip away or feeling that emotional distance can feel like an early loss. But remember, they can't control it. Instead of forcing conversation, meet them where they are. Speak gently, offer reassurance, and know that your presence is felt even if they don't respond. If a loved one becomes more forgetful, confused, or disengaged, don't ignore it. These changes often signal that body and mind are preparing for the final transition. Be patient, cherish quiet moments, and create safe, familiar, and peaceful environments. Because even when words fade, love and comfort are still felt. Let's move on. Number 4. Frequent infections and slow healing. As the body begins to shut down, one clear physical sign is a weakened immune system. Someone who rarely got sick before may now catch every cold, flu, or minor infection going around. Recoveries that were once quick become prolonged. Small cuts, scrapes, or bruises take much longer to heal. This isn't random. The body simply can't defend or repair itself the way it once did. Repeated infections become more common. Pneumonia, urinary tract infections, skin problems, oral infections. Families may view them as isolated incidents, but when they're frequent or persistent, they often signal a reduced ability to fight back. Even antibiotics that once worked quickly may require stronger doses, longer courses, or repeated treatments for issues that were previously minor. This reflects slowed circulation and organ decline. Treatments simply don't work as effectively anymore. Chronic wounds are another overlooked sign. Small sores or bruises that don't heal or reopen suggest compromised blood flow. Oxygen and nutrients don't reach the skin and tissues efficiently, delaying repair. The risk of pressure ulcers increases in those with limited mobility and can become dangerous if not managed. More concerning still, infections in the final year often lack classic symptoms. Instead of a high fever, an older adult may simply seem more tired, confused, or uninterested in food. In many seniors, sudden mental changes are the first sign of infection. Early detection can improve comfort and support during the final stage. For families, repeated infections are frustrating, and it's tempting to pursue aggressive treatment in search of a fix. But often, the focus gradually shifts toward comfort, hydration, skincare, cleanliness, and minimizing interventions that may prolong suffering. If you're finding this helpful, comment number 4 below to show you're here. And if you haven't already, subscribe and turn on notifications. Your support fuels our informative and inspiring content. Let's continue. Number 5. Major changes in breathing or circulation. One of the strongest signs that the body is preparing for the end is a change in breathing patterns and circulation. Your loved one may breathe more slowly or shallowly, pause between breaths, or show irregular rhythms, speeding up and then slowing down unexpectedly. Some develop cyclical breathing patterns, alternating deep, rapid breaths with long pauses. These changes may start subtly and become more pronounced over time. Weakened circulation is also noticeable. Hands, feet, nose, or ears may feel cold to the touch. The skin may appear pale, bluish, or mottled, especially in the extremities. The body prioritizes vital organs and reduces blood flow to peripheral areas. The heart pumps with less force. Shortness of breath may occur even with minimal effort. Sitting up, speaking, or changing position can leave them gasping. Mouth breathing may increase, or you may notice sudden pauses mid-sentence to catch their breath. Tasks that were once easy, like walking across a room, become difficult, signaling declining lung function. Fluid buildup can cause a persistent cough, wet breathing sounds, or chest pressure. This is often mistaken for congestion from a cold, but in those nearing the end, it reflects weakening lungs. Lying flat may become uncomfortable, and elevating the head with pillows or using a recliner can bring relief. For families, these changes are frightening. There's a strong urge to intervene, to encourage deep breathing, or to rush to emergency care. But often, this slowing is a natural part of the process. While it may be irreversible, comfort is still possible. A cool room, humidifier, small sips of water, and sometimes oxygen or medication can help, prioritizing ease over fixing the problem. If you notice breathing changes, cold extremities, bluish skin tone, or clear signs of slowed circulation, take them seriously. This is a time to offer presence, reassurance, and a calm, safe, peaceful environment. In the final weeks or months, the greatest gift is often not intervention, but comfort, dignity, and the knowledge that they are not alone. As we close this video, let's pause and reflect on what we covered. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing or circulation. These 5 signs commonly emerge in the year before an older person passes away. They don't always appear all at once, and they're not always obvious at first. But when they do appear, they often signal that the body is preparing for its final transition. For many families, accepting this is incredibly difficult. It's natural to want to fight, to encourage more eating, more movement, to push past the exhaustion. But sometimes the most compassionate response is to listen to the body's message and shift the focus. From trying to reverse the inevitable to making the remaining time peaceful, comfortable, and meaningful. Understanding this isn't about fearing death, it's about preparing. Early recognition allows for better care, timely decisions, and final months filled with love and dignity. It's a time to cherish moments, share stories, affirm their value, and remind them they are not alone. If you notice these signs in someone close to you, take a deep breath. Remember, you are not alone. Many families have walked this path. It's never easy, but knowing what to expect can help you find strength, patience, and peace. Thank you for being with us today. We'd love to hear from you. Leave a comment below with one thing you learned and how you plan to use it. Your thoughts matter, and sharing them truly motivates us. If this video helped you, please like, subscribe, and share. Your support allows us to keep creating high-quality content to inform and inspire. Thank you again.